In this video, I'm going to talk about what my rationale is for how I'm choosing a specialty to go into. I think it's still early days and I will definitely change my mind in the future, but I think these are the factors that I put into play when I'm thinking about choosing a specialty. So first of all is like what type of work do you do? So for me, the main pathways, I guess, in terms of background are like you can go physician specialties, which are like um, your medical, like cardiology, gastroenterology, rheumatology. You can go the surgical specialties, which are like heart surgery, brain surgery, general surgery. And then there's like the other ones that don't really fit in nicely with those, like obs and gynae, radiology, pathology, and then the critical care ones, anesthetics, ECU, ICU, ED, etc. So, like, what type of work do you want to do? Like, do you want to be doing like ward rounds in clinics? Do you want to be doing operations? Do you want to be doing like, procedures, etc.? I think that was relevant. So for me, I don't have a giant social battery. I'd say I'm probably more on the introverted side most of the time, and so I found like the idea of like doing operations like really cool. You can work with your team. It's largely sort of procedural, and that was more appealing to me than sort of doing a ward round and doing more like patient interactions. Whereas other people might like thrive off that, and I know most people don't have the same attitude towards the OR as I do. But what type of work do you want me doing, I guess, day in, day out? And what does like a consultant lifestyle look like in the end? Are they doing, mostly ward rounds and clinic jobs, or like research, or doing some other conference kind of thing? Or do you prefer like the procedural side of things as well? Lifestyle is definitely a factor. I don't, I don't think I realized like early on when I was thinking about it how important this was. Not because like sure, there's an element of lifestyle in the sense like okay, do you want to work do you want to work 9 to 5 or like 7 to 7? And then like some people would say, all right, I don't mind like working longer if it's something that I like genuinely want to do. But the thing that threw me was like the number of times you're going to get like called in spontaneously or in the middle of your sleep or things like that. And when I've seen some people who work in the more, especially the surgical fields, which are like really high acuity, they have lots of emergencies. And like the idea of, for me having to like, cancel on a friend last minute or like miss like, your kid's like birthday last minute or like wake up in the middle of your sleep like every day for like a week or something. Like those things are a lot different to just like working 80 hours a week versus 60 hours a week, for example. So, like, yes, working longer is one thing, but also like you losing the control over your time, losing like regular sleep, um, inability to like rigidly attend the things that are important to you. Like those are all like important factors as well, which I sort of factored into things. Obviously, like what you like doing, what interests you. So, some people love like thinking about like orthopedics and like bones, and they just have a passion for it. Some people love brains and psychiatry and all things brain. Some people love well, I don't know if anyone really loves colorectal. Well, who knows? Maybe they do. Well, obviously, what you're interested in should play a part. What provides you the most meaning? I should also put in here like the outcomes of the patients you're working with. So if you're going into like a specialty where, people are really sick and unwell, and then you have lots of bad outcomes, like that's going to take its toll on you versus something where, the outcomes are a lot better, you have high cure rates, etc., less sick people. That's one thing I considered. By meaning, I also thought like, I guess for me, working with patients like face to face is still important, which is a factor when you're deciding like there are some like roles that you don't have to deal with patients that much, like radiology or pathology. Um, but then you've got to again decide like what scope of work. Do you want to be looking at like screens and in the lab, or do you want to be, interacting with patients? But I think I haven't like experienced this yet, but I'm sure like the some positive interactions that you have with the patients will be important for me. Um, what is relevant to the future? So I'm sure medicine is going to change a whole bunch in the future, but the classic example is like, will AI replace like radiologists and dermatologists? So things like that, I think are relevant. How do like guidelines change your ability to make clinical decisions? Will you just be ordering all these tests because you're forced to, or is there a role for the sort of clinician mind? That's an interesting discussion. And then obviously you have like your own research. So to be honest, I think most people's specialty is just decided by like what rotations they randomly get. Obviously, I've watched all the like med school insiders videos on, oh, like these are the lifestyle specialties. This is the pros and cons of this specialty. And then have a chat to people who are working in that field as well about where they see the future lies and essentially whether they would recommend you going into that field. So, for example, like I was really interested in like upper GI surgery, which do a lot of like bariatric weight loss surgeries. But then now that they have like drugs like Ozempic, that might not be a realistic field in 10, 20 years when there's medications that control people's weight. Who knows? Maybe it will be, maybe it won't. But that's like picking a specialty is kind of a big deal. So you just have to be aware of those things. Now, one factor I put here is competitiveness. And you hear this all the time, like, oh, I really want to go into this specialty, but it's competitive. But I mean, it's like a pet peeve of mine because I think, and I'm sure people who say that are just like acknowledging that, yes, it is competitive. But I think if you really want to do something, competitiveness shouldn't be a factor. Um, if you really want it and you keep like getting after it and you put your best into it, I'm sure like you'll get there. And so I think the people who think about like competitiveness, I don't really think that's as important as all the other factors. I haven't written money here, but it's another thing. Like I feel like once you pass a certain level of income, like the work you're doing is just more important than all that things. So, and I think all the specialties like compensate past that certain level. So I'm sure, like would you rather earn like I don't know 200K a year or like 300K a year, but you get like called in the middle of the night and you have this like high acuity lifestyle and have the lifestyle sacrifice. And that's like different people have different points of view. The thing about emergencies is they're actually like exhilarating as well. So, for example, like if someone has a ruptured aneurysm and you get like to be the person who treats that, like that has its own like feeling as well. So it's not like a downside necessarily. The high acuity jobs are definitely for like the sort of adrenaline loving people. But they're all just considerations to put into a big picture. And then you not only have to think about what you now could do, but what you maybe like with a partner, with a family, when your like parents are elderly, like what you in that future would prioritize as well. So it's an individualized decision, which I'm still making and changing. And I should stress it as well that almost everyone seems to change their mind from med school to working as a doctor. So they say you only know after you've done like 6 months in that specialty in like an unaccredited position. So I'm sure as I experience these specialties in the future, actually working in them, it'll have a completely different tone. And who knows, I might completely switch up. Um, but hopefully, like the people who are thinking of going into a specialty or choosing what career path have been thinking about these sort of factors, and hopefully this brought some different level of insight into your current thinking. Stay tuned for more videos, guys, but thanks for watching, and I'll catch you soon.